Hello, everyone. Welcome to the MMOA podcast brought to you by the Institute of Clinical Excellence. I'm going to be your host today from Littleton, Colorado. My name is Ellen Seppi, and today we are going to be talking about creatine for older adults. So, a lot of you guys may have heard of creatine, know what it is, use it for yourselves. But in our podcast today, I'm going to tell you guys a story about my clinical practice and use of creatine. We'll talk about the research behind creatine and some guardrails for your use in the clinic and recommendations to other patients. Before we get started, let's talk about our upcoming live L1 courses. We've got one in Chandler, North Carolina in December 2nd through 3rd, one in Portland, Maine with me, Alex, and Shelby. We'll be there in December from the 9th to the 10th. And then my home state of Ohio is going to be hosting a course, the first course of the year in January 13th through 14th in Marysville, Ohio. Hope we can see you guys there. If we can't, we have our online cohorts starting in January. L1, formerly known as Essential Foundations, will be starting on the 10th. And L2, where we talk about the advanced concepts, is going to be starting January 11th. So, let's talk about creatine. So, creatine is something that our bodies produce naturally in our kidneys and our liver and is stored in our muscles. It's an amino acid that is stored in our muscles and is an important component for our brain health and our muscle function. Now, when you guys hear creatine, you might think to yourselves, oh yeah, I knew somebody who took that when they were a college athlete or when they were training for a bodybuilding competition. You're exactly right. So creatine monohydrate is one of the most widely used supplements to improve performance, and we have significant data that creatine increases muscle endurance, muscle strength, muscle power, and muscle size. So we know these things about creatine, and if you're like me, you know that our older adult patients have the most to gain in those domains from that benefit. So, what I'm here to tell you is that your D1 college athletes sure can use creatine, but so can your older adult patients struggling with age-related loss of muscle mass. I want to tell you guys this story about my patient. We'll call him Rick. So, Rick is a really special patient to me. I'm definitely going to send him this podcast to listen to later. He's in his late 70s, and he's had a complicated history of back pain. He has Parkinson's disease and has been diagnosed with Parkinson's disease for several years. And last year, he made the decision to have his scoliotic curve, which was progressing in intensity, surgically corrected. And it was a tough call, but he had a fusion from T6 to S1. That's a big fusion. His post-op recovery did not go swimmingly. He had a lot of complications. He had a fall. He broke his hip. He was in acute rehab, inpatient rehab, and subacute rehab for months. He lost a lot of his strength during that time, and life was pretty hard. He made it out of that stent with a lot less strength than when he started. So Rick, my patient, who I had seen before this fusion and the complications, returned back, and we're gradually making improvements in his strength. To Rick's credit, he is one of the hardest workers that I've worked with. He's a retired military personnel, and he applies that work ethic to his recovery. So he was making gains, but just to kind of get a clinical picture, he's a tall fella and was unable to do a sit to stand from a standard 17-inch chair. So obviously he had a significant risk of falls. Rick had slow gait speed, and his balance was definitely impaired. So he was struggling. And for one reason or another, Rick wasn't able to come to therapy for several weeks. And if you know Rick or a patient like him, that makes you give me one of these. Like, oh gosh, what am I going to walk into when he comes back? Before he had this lapse in his care, we had talked about creatine. When he came back, he was using that cane like Mr. Peanut. It was a prop. He didn't even need it. He was able to do 5 sit-to-stands from a 17-inch chair. He was significantly better, and my mind was blown. And I said, Rick, you've been doing something different at home. Tell me about it. He said, well, I've been consistent with my strength training program that you gave me, and I started taking creatine. So, of course, this is an anecdotal story about one of my patients, but I want to talk about a recent systematic review by Stairs et al. That was performed in 2020 and looked at the benefits of creatine use in older adults. We have robust research that creatine is very helpful in improving muscle mass, strength, and functional independence in older adults. For context here, I know when you guys think creatine, something goes through your head that's like, this feels like a board question, and I might want to be concerned about kidney health. So in 2003 and 2009, the ACSM determined that we needed to have more studies done on the benefits of creatine with healthy individuals because of the potential risk of kidney and liver dysfunction. Those studies on healthy individuals were likely impacted by extreme training conditions, which were disproven to be injurious, that creatine was injurious to our kidneys and our livers. So this study not only wanted to look, this 2020 systematic review wanted to look at the benefits of creatine for older adults in regards to training. Also, it aimed to look at impacts of creatine on bone mineral density, and impacts of creatine on cognitive health, because there's more research coming out looking at cognitive health or the impact of creatine on cognitive health. So the systematic review looked at 17 different studies and showed that creatine does have a significant benefit over training without creatine in older adults. This research study was really well done, and it included most of the studies looked at creatine in a daily low dose, somewhere between 3 to 5 grams a day. But the most important thing is that all of the individuals doing or who participated in these studies included in the systematic review were healthy individuals involved in resistance training exercises. So what did we see? There was an increase in lean muscle mass, especially in older adults. The exercise alone, so we know that the improvement in our lean muscle mass and body composition was significant. We looked at functional independence, which was significantly different in older adults who took creatine compared to those who did not during the resistance training. And we know also that their strength increased more than those older adults who participated in only resistance training exercises. So we know that resistance training plus creatine has significant impact on our patients, and that should liberate us to feel confident in prescribing it. The caveats we'll talk about in a little bit in regards to who's safe to take creatine, but the systematic review did not indicate that creatine has any more benefit than a standardized resistance training program on bone mineral density. So the jury's still out as to whether or not creatine increases bone mineral density combined with resistance training. Another component is that this research study, this systematic review, did not indicate that creatine has a superior benefit than resistance training alone on cognition. So an important thing is that resistance training does improve cognitive health in older adults. Creatine just didn't make that much of a difference. So those are the kind of takeaways here. Now, I'm sure you guys are chomping at the bit to know, well, how do I apply this to my clinical practice? What are the rules for telling patients that it's safe to take creatine? So the APTA emphasizes that diet and nutrition are key components of many, this is a position statement from the APTA, that diet and nutrition are key components of many conditions managed by physical therapists. What's more, nutrition can directly affect recovery and function while an individual is under a physical therapist's care. It makes sense then for physical therapists to be concerned with and address nutritional intake and eating patterns of their patients and clients. Nutrition is part of the professional scope of practice for physical therapists. So we know that it is within our scope to talk about nutrition and supplementation with our patients. Now, I know what you guys are thinking. What about the state laws? How do I know that my state isn't weird? Good news, a lot of states are relatively vague about what we're allowed to recommend to patients in regards to nutrition and supplementation. There are no states that say it is outside of our Practice Act to counsel patients on nutrition and supplementation. The only state for physical therapists that discusses whether or not it's safe for us to recommend supplementation is in North Carolina, where you may not sell creatine within your practice and make money from a product that may not help your patient. So the only rules in any of the states are in North Carolina, where you cannot sell those supplementation products. So if you want to look at your state's practice guidelines, go to your state board and look under those practice guidelines and the rules and laws within your state that apply to your specific profession. But in general, this is something that we can counsel patients on. So when is it appropriate and when is it not? In that systematic review, those participants in the study were healthy older adults. So before you go buck wild and tell all of your patients to start taking creatine, we should be team players and coordinate with our primary care physicians, especially in the cases of kidney disease and liver disease. Those two processes are important because creatine requires clearance from those organs, and making sure that those organs are healthy is an important component that needs to be addressed by our patients' primary care physicians or practitioners. So be cool, phone a friend, ask and make sure that it's all right with patients' PCPs, or advocate for them to ask their pharmacist or their PCP if creatine is safe for them to take. Some side effects that were noted in that systematic review were GI upset and bloating. Though a common side effect with creatine use is a slight increase in weight, it's largely attributable to water weight and that water retention associated with that supplement, not necessarily an increase in fat mass. And actually, there is a notable increase in lean muscle mass with creatine use. So yeah, you might gain weight, but largely that's going to be either water or muscle. So if you want to talk with your patients about creatine usage, what's the appropriate dose? You can advocate for the patient to talk with their doctor, but in general, a daily dose of somewhere between 3 to 5 grams was recommended in that systematic review. Some of the studies included an increase in creatine over the first week and then a slight taper, but in general, a small daily dose or dose with training has been shown to be effective for older adults to get those benefits from creatine. So, all in all, guys, I hope that my heartwarming story about my friend Rick could be helpful and encouraging for you to know that your patients that have the most to gain from supplementation can see meaningful improvements in their strength and their power. Rick, my friend, even came in today saying, wow, I can feel that my pants are getting snug around my thighs. I can really feel that I'm stronger now. He's able to walk several miles with his family again. He's able to travel through the airport, and his family is noticing how much stronger he is. I want to note that came not just from creatine use, but from consistent resistance training, which is an important key to using creatine. You won't see those benefits from that use unless you're combining it with resistance training. That's how you get that. So we talked about the research and how all of those participants were combining resistance training with creatine use and saw a significant improvement in their strength and their function. Not huge significant changes yet looking at their bone mineral density or cognitive health, but we may see more of that research in the future. And again, those guardrails for when to recommend creatine: be a team player. If your patient has liver or kidney disease, talk with their doctor or advocate for them to talk to their pharmacist or their doctor to know whether or not it's safe for them to use. And in general, if you have concerns about your patient's health, coordinating with their PCP is the safest move, but you should feel confident as a PT in advocating for your patient's nutritional health and supplementation, including creatine. So thank you guys so much for joining me today, and I hope that you can apply this information to your patients so that they can get strong. Have a great rest of your evening.